What's glaucoma and why is it dangerous and what can it do to eyesight?
So glaucoma in a nutshell, I'll give you a little Cliff Notes version of glaucoma.
Good.
High pressure in the eye can damage the nerve in the back of the eye slowly and progressively over time. The reason it's dangerous is because, first off, we mentioned high pressure, but the pressure is not always high, and the vision loss from glaucoma can happen silently and slowly over time. So people can have a lot of vision loss before they actually get diagnosed and realize that there's a problem.
So regular exams is what you're saying you need with glaucoma, because that can be silent, it can be progressive, and all of a sudden you don't have vision in that eye. How do you measure to see if there's glaucoma?
So historically people just looked at the pressure. One of the things that we've learned over the last number of decades is that glaucoma is much more complicated than just what the pressure is. So in order to get an adequate glaucoma exam, you really need to have a dilated exam, let someone dilate the pupils and look at the optic nerve, because ultimately glaucoma is a disease of the optic nerve, and so if the optic nerve looks healthy, that's going to go a long way to maintaining good vision.
Are there eye drops and medications to decrease the pressure in the eyes to keep somebody from going blind?
You bet. So glaucoma is one of the leading causes of preventable, keyword, preventable blindness in the world. So the way you prevent it, early detection and treatment.
How often should people have their eyes checked as they get older?
General recommendation, if everything's going well, would be about once a year. And then if your eye doctor sees some issues, they might want to see you a little more often than that.
So very, very important. What happens if somebody says, I don't need to go? That means they can get blind and their eyes can go bad.
Unfortunately, I have seen that more times than I would like to count.